lead correspondent from mindyourmind.ca, and here with us today is Dr. Wayne Hammond, the Executive Director of Resilience Canada. Welcome.
It's a pleasure to be here.
So first off, how would you briefly describe what resiliency is to young people and the importance that it plays in today's society?
Yeah, maybe to help with that is my background is in the area of clinical psychology and therapy. So we've been trained to sort of look at people and see what's wrong with them. And we put labels to that. A person's depressed, a person's oppositional, or things like that. But what I have been finding in my practice is that that's not always a good starting point to talk to young people about change or looking at ways that they can maybe cope better or better their lives. What I'm finding is that this idea of resiliency is that it believes that everybody has potential. Mm-hmm. All kids have the ability to do great things. And what we're seeing in the research is that if kids have a certain belief about themselves and know how to access certain resources around them, they tend to overcome difficulties in very positive, functional ways, but in ways that are meaningful to them. One of the challenges I think we have in society is we tend to sort of say, this is the way things should be done. And if kids don't do it, we put a label to it, and then we box them into a corner. Mm-hmm. And by putting labels on kids, we limit their options. And so part of what I'm practicing as a psychologist now is maybe a better starting point is to look at what kids are doing well, or look at their strengths and use that as a starting point to talk about how things could be different for them when they face challenges in life, whether that's a mental health concern, sort of a logistical concern, or a friendship concern. But what I'm finding is that kids seem to be much more receptive, because then we're going from what they understand and we can take a leap into taking chances or exploring, as opposed to telling them what they can't do and then expecting them to do more of it.
Okay. Also, how does resiliency, your theory and your approach, how does it compare to other theories that are already published, such as the cognitive behavioral therapy?
Yeah, this isn't about resiliency is better than the other. This is more of a concept. It's a philosophy of practice. There is a role for cognitive behavioral. There is a role. But it's really interesting. One of the studies out there actually took a comparison between cognitive behavioral, solution-focused, psychodynamic theory. And what it found is that no one particular theory was better than another. The more interesting study that actually came out is when they actually took professional therapists and compared them to lay people who had no training in counseling. The lay people actually had a more profound change influence on people who were dealing with difficulties. So that seems to say something to me, that change actually resides within people. Youth will make changes. It's not professionals making change in youth. If youth understand things and they develop a sense of optimism and know how, they will make changes in their lives. They need somebody to come along and facilitate and walk with them in their shoes, not somebody diagnosing them and prescribing an intervention. So cognitive behavioral can play a role, but if it comes in as a fix-it model, then our success rates are not all that great.
Mm-hmm. Well, I guess that's understandable, being able to learning how to deal with future problems and stuff like that, instead of having someone a quick fix, because there aren't actually even with medication, it's hard to just give someone, because it doesn't actually cure the problem, it just kind of aids it along.
Yeah, I think there is that idea that you need to pay attention to stabilizing. If the circumstances that a youth is dealing with are risk oriented, then there is a need for sometimes outside groups, individuals, to make sure that there's a stabilizing. And so if a person is dealing with a serious mental health disorder, then a pharmacological approach or using drugs is a good way to start the stabilization. Mm-hmm. But that we don't stop there. We need to then move to the next steps of how do we prepare this youth to take on life. Mm-hmm. With potentially a particular challenge that may never go away, but they know how to utilize that challenge in constructive ways and better themselves.
Okay, so as far as, say, because Mind Your Mind, we're not only for getting help and reaching out, but also giving help, so providing help for friends, family members, of the youth age. And you just said that it's important for youth to understand that they can get help and to find that they have good role models, good mentors. Right. What would be, I guess, a good piece of advice you could give for a youth looking to help someone else in their age group, another youth, a friend?
Yeah, we know in the research that positive friendships are a protective factor, because there's some things that kids will talk to peers about that they won't talk to an adult. And so what we need is a balance. We need adults in our lives, we need good friendships, we need good interactions at school and community, and then those internal factors. And so, we need to choose our friends wisely, though, because you want to add to your picture. Do your friends add to who you are, or do they take you away from your goals? And sometimes those are tough decisions because we want to be wanted by people. But we need to be purposeful who we have in the inner circle. And it's okay to have lots of friends, but who do you bring into that inner circle needs to be a very purposeful choice.
Also, I know a lot of times, like also speaking from like personal experience, once you like kind of are confronted with an extremely stressful situation or other mental illness like depression, anxiety, I know that a lot of times, especially youth, are so focused on the point that this is it. It's not getting any better than this.
Right.
And they're really kind of overwhelmed by the fact that maybe I should just accept the way that things are because I either don't have good support in my life, I feel ostracized, like I don't have a lot of good people to help in my life. I don't have anything to look up to kind of help me through this difficult time. Is there a way that like youth can either control their like internal or external factors that are affecting it, or is this something that they can change, or?
Well, I think when you're dealing with certain mental health concerns, like we know that depression can come from a number of sources. It could be a genetic predisposition to it, could be potentially of a traumatic event that occurred in a person's life. So yeah, there are practices to help kids understand potentially why they're experiencing something. And so getting information and being knowledgeable about what's happening with you is definitely, in my mind, an expression of enhancing your resiliency. But I think one of the things that we have to, and this is maybe more of a challenge towards the helping profession, is that what we've done is we've allowed kids to live with the label and allowed the label to determine who they are. And it should be the opposite. Kids should determine who they are. And they may experience certain challenges in life, and it could be a mental health concern, but that doesn't determine their identity. They'll determine their own identity. And that particular challenge may become a catalyst that would enhance who they are and make them a better person. And so we shouldn't sort of take this idea that we should live in a society where there's no challenges, that kids have no problems whatsoever. Because it's through challenges, it's through sometimes chaos that we actually start to understand who we are. But that's a guided process, and sometimes kids need people on the outside to help them walk through that in a constructive way and not allow those circumstances to overwhelm them.
Okay, well, thank you very much for coming and
pleasure.
talking with us. Yeah, it was great, very informative.
Well, thank you for having me.